and welcome back for another edition of Safe and Sound. I'm your host, Doug Bolnick, from the St. Charles County Department of Community Health and the Environment. On today's show, we're taking a look at programs in our community that keep us healthy and safe. One of the biggest public health threats we face comes from the dangers of smoking, both for smokers themselves and others through secondhand exposure. To learn about the harms of smoking and to discover programs designed to help us quit, I'll talk with St. Charles County Health Educator Brittany Schulteheinrich. Then, Community Health Nurse Jennifer Moll will show us how vaccinations and preventative action can stop diseases caused by the human papillomavirus. After that, Bev Pennington will tell us about the American Red Cross's disaster response teams that help us in times of emergency, and Julia Crutchfield from United Services for Children will explain how her organization helps families with autism. Lastly, Deborah Christensen from St. Charles County's Division of Environmental Health and Protection reveals how recycling and other conservation strategies enhance our community. But first, to give us an idea of the programs and services it provides, the Director of the St. Charles County Department of Community Health and the Environment, Julie Eckstein, introduces us to the Division of Public Health.
The St. Charles County Department of Community Health and the Environment has 3 divisions. It's a very fun place to be. We have the Division of Public Health, which is one that a lot of people think about. We also have the Division of Environmental Health and Safety, and also the Division of Humane Services, which is one that people don't always recognize as being as part of our department. So our Division of Public Health is one that's here and ready to help you with any of those kind of things. We offer a variety of services that can be helpful, whether you're talking about needing some education about health. We have a health educator that can go out to your organization or to schools, all kinds of different places, and provide some information, whether it's about smoking cessation or about nutrition or other things like that. We also have a lot of services that are provided here in our building that people can take advantage of. We have an STD clinic. STD stands for sexually transmitted diseases. So if anyone has concerns, having any symptoms you're not sure about, you can sure give us a call and talk to a nurse practitioner or a nurse and find out if you're an appropriate candidate to come into our STD clinic. If you're interested in making an appointment or finding out about that, you can either do that through a phone call or through our website, and we'll give you information about that. But we also have services, 2 other clinics, as we call them here in the building. One is our WIC clinic. So if you have a child or if you're pregnant and you want to ensure that you have good nutrition and a healthy pregnancy, that would be a great program for you. So if a healthy you might entail a new child in the new year, please think of the WIC program. There are eligibility qualifications for that program, but it's really a wonderful service to ensure that you have a healthy pregnancy, a healthy birth, and a child that has the nutrition that they need. So in addition to the WIC program, then we also have an immunization clinic. Immunizations are such an important part of staying healthy, whether it's for you as an adult or if it's for your kids. So a lot of the childhood immunizations, you might have heard from your pediatrician what the list is that your child needs to get at different intervals during their growth period. So you can come in and get those immunizations here at the clinic. And also we provide adult immunizations. So you might have heard, you need a tetanus shot, those nasty rusty nails that you might step on, or whooping cough is an important one these days, and that's pertussis and the Tdap shot that we give. So if you're going to be around kids a lot, maybe grandparents, and you want to ensure that you have healthy environment for your grandchildren, please make sure you're up to date on immunizations like that Tdap, and you can come get that from us as well. One of the very important roles of our Division of Public Health is investigating any kind of outbreak, potentially. And we call those communicable diseases. And it's really important that if we find out any information through our area hospitals that we've gotten a positive lab result, for example, through a doctor's office or a lab, then we definitely jump into action. The purpose of this is to ensure that the community stays healthy. We don't want any diseases to be spread from one person to another. So we do investigations. We have an epidemiologist here in the department who's in charge of that, who leads the pack. And working with our communicable disease nurses, they try to find out what has been the cause of that illness and how can we prevent that from spreading to anyone else in the community. So that's a very, very important program. Another one that's similar in the keeping people healthy and keeping people safe is our emergency preparedness and bioterrorism program. That one, sounds a little bit more scary, and actually the implications can be scary of something like that. You see on the news sometimes things that have happened, whether it's a chemical that has been found to be in the air or things that happen like at the Boston Marathon being terrorism acts. So we try very, very hard to make sure that our plans are in place. How would we prepare for a situation like that? But even more important is how do we prevent situations like that? So we are constantly doing what we call in public health surveillance, making sure that we are watchful for any signs, symptoms in the community for things that might be happening. And we encourage you as members of our community to be watchful as well and give us a call. If you ever think that something doesn't look right, something that's out of place, please make sure that you let us know so we can follow up. And we work hand in hand with law enforcement and our emergency preparedness staff in other parts of the county, emergency management staff, and make sure that we have a good team approach, working with others in the community as well and community organizations to keep your community safe. One of the most popular programs that we provide here in the department is through our program of vital records. People may not know what that word means, but vital records basically are birth certificates and death certificates. So something that brings people into our department very, very frequently. So if you ever need a birth certificate and you were born here in the state of Missouri, it's likely that we're going to be able to provide that for you. It's a very quick and easy process. Just takes usually about 10 minutes or so. Come in and fill out an application, pay by cash or check, and we can give you that birth certificate right here. Similarly, death certificates. So unfortunately, if you've experienced a death in your family and need a death certificate for the follow-up and closure of so many things, whether it be an insurance policy or to verify that the person has passed away, you can come in here and we'll also provide that death certificate. If anyone needs further information about the services we provide here, or if you'd like to make an appointment with any of our clinics, just feel free to give us a call at 636-949-7400 or visit us on the web as well. The county website provides great information. You can drill down to our department and find out about all of our services.
Thanks, Julie, for introducing us to these services. A Center for Disease Control and Prevention study found that about 70% of adult smokers would like to quit, but it is very difficult to stop this addiction. However, there is help available, and St. Charles County Health Educator Brittany Schulteheinrich is here to offer suggestions. Brittany, thanks for joining us today.
Thanks for having me.
Why exactly is it important to stop smoking?
Well, the health, social, and economic benefits are many. Quitting smoking has long been considered the single most important thing a person can do to improve their overall health. For the past couple of decades, smokers have been increasingly stigmatized in our society, and this occurs both in the professional and in social settings. And finally, it's going to have an undeniable positive impact on their bottom line, which means more money in the pocket of former smokers.
You mentioned that there are health benefits for stopping smoking. What are some of those?
Smoking is the #1 cause of preventable death in this country. That means more people die from smoking-related illnesses every year than AIDS, suicides, homicides, and car accidents. So that's very significant. 1 in 10 heavy smokers will develop lung cancer, and there's over 69 carcinogens or cancer-causing ingredients in a single cigarette. Quitting smoking is very difficult, but I think even though there is about 19% of Americans who currently smoke, there are more former than current smokers in the United States today.
It's very difficult to stop smoking, but cessation classes can help. What exactly would you expect to do at these classes, and how are they helpful for you?
Many quit smoking classes begin by helping the person assess their readiness to quit. Self-motivation is absolutely essential for any quit attempt to be a success. It takes the average person 7 to 9 times of trying to quit before they can be successful. The next thing you're going to want to do is help the person explore their smoking habit and the addiction process. This will help them identify their personal triggers so that they can develop a quit plan that's tailored to them. A lot of programs also will help participants learn about quit smoking aids such as nicotine replacement therapy, and that includes things like patches, gum, and the lozenge, and also pharmaceutical products like Chantix or Wellbutrin. And finally, they're really going to want to explore maintenance and resiliency skills to help a person maintain that smoke-free lifestyle long after the class is finished.
These classes sound really helpful. Are there some of them here in St. Charles County, and how would someone find out about them?
A really great resource for people who are looking to quit smoking would be the American Lung Association. They have several different types of programs to help people quit. They can call their local American Lung Association chapter to see if there's a Freedom from Smoking clinic, which is more of a support group, and a person would attend 7 sessions over 7 weeks. Then there's also an online program that a person can do from home. And they have a helpline at 1-800-LUNG-USA, and a person could call in and get resources and talk to a quit counselor. We have our Missouri Quit line, which can be reached by calling 1-800-QUIT-NOW, and they also have a variety of different resources for people who are looking to quit smoking. And finally, our local hospital systems, including BJC and SSM, offer quit smoking clinics, and all one would have to do is to call their local hospital to see if there's a program going on.
Thanks, Brittany. It's always great to hear from you. It's encouraging to know the benefits of stopping smoking start soon after you've quit and are long-lasting as well. Stay with us to learn more ways to improve our community.
So, I got this new family. And I don't know what it is about this one, but she can't seem to put down that toy. Oh, and she even talks to it. Who's she talking to? Her mom? She talks to her mom a lot.
Welcome back to this edition of Safe and Sound, where we're talking about how public health services aid St. Charles County. Human papillomavirus is a common sexually transmitted infection that can affect both males and females. However, getting vaccinated can prevent this and other related diseases. Community Health Nurse Jennifer Moll explains how.
The human papillomavirus, or commonly known as HPV, is a sexually transmitted infection that commonly affects both the men and women. There's currently over 40 different types of HPV that can cause genital warts, cervical cancer, oral cancer, and anal cancers. HPV is spread by sexual contact. Anybody who is currently having sex or has had sex in the past can get HPV. Some of the potential health problems caused by HPV can be the genital warts in both males and females, and then specifically in the females, abnormal pap smears. And with abnormal pap smears, that can also lead to cervical cancer in the females. HPV tests are available to women over the age of 30, but currently it's not recommended for men, adolescents, or women under the age of 30. And currently also there's no testing for one's overall HPV status. So there's 3 levels of abnormal pap smears. Typically they do high risk HPV testing, meaning they're testing specifically to the 4, like about maybe 10 different types in women over the age of 30. With the recommendations to start pap smears at 21, so HPV may take about 10 years to start, so then they're going to start seeing that HPV maybe in about age 30. So now if anybody's 21 to 29 years of age, have an abnormal pap smear, most of the time if it comes back abnormal, there's on the lab rec you can write to do it to reflex to HPV, so meaning if it comes back abnormal, the lab will run the HPV testing on that pap smear. HPV can be prevented first by abstinence, and then also HPV is spread by skin-to-skin contact, so even with using a condom, it can't be 100% effective. Another prevention tip is to be vaccinated against HPV. The health department currently carries Gardasil, which covers the main 4 types of HPV. It is currently licensed for ages 9 to 26 years of age and can currently be given to both males and females. Another vaccine out on the market is called Cervarix, and that can be attained from your medical provider. If someone has HPV or thinks that they have HPV, they should contact their medical provider for further assistance. And also for the vaccine, you can contact the health department at 636-949-1857. More information is available from the CDC website at www.cdc.gov.
Thanks, Jennifer, for helping protect us. The American Red Cross and its volunteers also help in times of need. One of those volunteers, Bev Pennington, joins us now to discuss the Red Cross's disaster teams. Bev, thanks for coming in today.
Thank you for having us.
What exactly is the focus of the Red Cross disaster teams?
The Red Cross Disaster Action Team is what we call DAT. And what we do is we go out when there's a disaster strikes, fire, flood, whatever the event may be, tornado, and we go out there, and our main focus is to serve the community and help the firefighters as well as our clients who have just suffered great loss. And at that point we will talk to them, calm them down, and help them with their first steps.
Great. You mentioned some of the responses that you actually follow up to. How do you respond? Is it automatic, or is there a call for help, or how does it work?
Our team is totally voluntary. So we assemble our team, and then we prepare our truck with various items to assist us throughout the day. And then we'll go, and then we are called out by the dispatch from the fire department to lead into the area that is in need of help.
I think it's fantastic. It's just a total volunteer team. How can someone join that?
To volunteer for us, you just simply go on www.redcross.org, register as a volunteer, and then they will call you, set you up with an interview, and then you'll start your orientation.
And at that orientation, is it something that you should have a set of pre-existing experiences, or can you get all the training once you sign up and go through the orientation?
All the training is provided by the Red Cross. They're excellent in making us sure that we're knowledgeable, comfortable, and ready to go when we're out there in the field. They want to make sure that we are not stumbling around, and our purpose is to help the client, make them feel comfortable, provide them with any assistance they need. It may be food, clothing, and shelter for the first 3 days after the event. That's the first step that we ask them to take. And then from there, if they may have insurance or not, we let that kick in, or then we might tap into different other community affairs.
Fantastic. How can people learn more about the program and about what the Red Cross does to help the people of St. Charles County?
To learn more, just simply again go on to www.redcross.org and /STL, and there are many different areas there that will help them learn more about it. We do have people that are always willing to talk to you about it and just express what we do and our love for it, because we're very passionate about going out and helping the community, helping the firefighters progress along.
Well, thanks a lot, Bev, for everything that you and your volunteer teams do.
Thank you for allowing us to come and share the Red Cross story. Our mission is important, and we are here to serve the community.
We'll present more ways to keep you safe and sound right after this break, so stay tuned. Welcome back to Safe and Sound. I'm your host, Doug Bolnick. We're talking today about ways that good health makes St. Charles County better. A number of agencies in our area help children with developmental disabilities. United Services for Children is one of those wonderful organizations, and Julia Crutchfield from United Services is here to provide a closer look at autism. Julia, welcome to the show.
Hi, thanks for having me.
United Services does a great job of helping children with developmental disabilities. Can you tell us a little bit about what you do?
Sure. United Services for Children is a nonprofit organization that works in part with United Way. We also have funding from people around the community, as well as we partner with local school districts. We partner with Fort Zumwalt, St. Charles, and Orchard Farm. So we provide early childhood for those school districts, as well as we're branching out into other things such as providing outpatient pediatric therapy.
And one of those developmental disabilities that you do work with is autism. What exactly is autism?
Autism, or autism spectrum disorder, is the disorders of brain development. So an individual can look very different that has autism spectrum disorder. They may have difficulties with their social interactions. They may have difficulties with verbal or nonverbal communication skills, and they also have difficulties with stereotypical behaviors that they participate in. They may have difficulties communicating with you and knowing how to position their body and that natural space between us that creates that comfortable communication, as well as they may be talking to you from long distances and not realizing that that's inappropriate to start a conversation across the room when they can't hear you or you can't hear them. Their communication can be different with nonverbal and verbal communication. Some individuals with autism spectrum disorder are verbal. They may learn phrases that they repeat over and over and use at appropriate times, but they have difficulty creating their own thoughts and ideas. There are some individuals who are nonverbal. About 25% of the group tend to be nonverbal, and they may use pictures or an iPad or something to communicate their wants and needs. Individuals with autism spectrum disorder also have difficulties with stereotypical behaviors. About 60% of the group may have below average intelligence, so you're looking at 40% that have average or above average. They also have physical differences, difficulties with sleep, difficulties with eating, gut and intestinal issues. So that's a concern, as well as attention. Attention can be shortened, and it can be harder for them to stick with a task and learn from the task.
If someone notices some of these stereotypical behaviors, what are some signs and symptoms of autism?
If you're engaging with your child and at 6 months of age you still feel like you don't have that clear connection, you're not getting that feedback and feeling like this little person is responding to all the social interactions you're presenting him or her with, that could be a red flag. By 9 months, if a child isn't making those back and forth sounds with you, again, that could be a concern. And at 12 months, if your child isn't participating in babbling, that's typical for that age, or responding to social cues such as reaching up for you and wanting you to hold him or her, showing you toys. Kids get really excited about showing you stuff. Waving, pointing, those gestures, those are all things that we look for. If your child hits 16 months of age and they're still not using words, that might be a concern. And at 24 months of age, we really look at children starting to combine some thoughts to words, original things, to show what they're thinking and feeling. And if children aren't doing that, it might be something that you want to mention because it could be a concern, and maybe it's something and maybe it's not.
And the individuals, obviously we're talking about children at this point in time, but
Sure.
People can definitely become active members of their community.
Absolutely.
What are some of the treatments that can be put into place that can help both the individual that may be suffering from autism and then also their families as well?
Early intervention is a huge thing, of course. So earlier we start, the better. Working with these children and putting a team into place of intensive behavioral therapy, helping these children learn from their environment, basically. We're teaching these children how to access information and learn. And as they grow through the school system, then they can continue to get support from their communities and participate in their communities, much in the same way that many of us can. We all have something to contribute, so it just may be to varying degrees.
You talk about the community. Why is it important for us to be promoting autism, and what are the benefits of doing this?
Well, currently the statistics are pretty scary. 1 in 88 children are diagnosed with autism spectrum disorder, which, when you think about it, it's about 2 million people in the United States. So, somewhere along the line you're going to encounter somebody that has this difference. So it is important to get funding out there and to start working to help these individuals become successful so that they can live productive and happy lives such as you and I, and contribute back to society in the way that they want to.
And one of the programs that's popular here in St. Charles County is a new Care Check program. Can you talk a little bit about that?
Sure.
What benefits can it do?
Sure. Children with autism spectrum disorder and older children, because these children grow into adults and they may be bigger in body, but not necessarily developmentally. They may not have caught up. So It is very important that we monitor these children and help support them, and some of these children tend not to know safety concerns. One of those things being wanderers. There are many children who don't understand that they can't just walk out the door and walk away. So CareTrack is a system that's been put into place, a program that St. Charles County families can participate in. It's basically a tracker that they can wear on their wrist or their ankle, and it's able to help them. Let's say your child goes wandering out, you're able to call 911 and you're able to locate that child via 911, the emergency system then. So they're able to track the children within like a 1 mile radius, so that would be very important.
Well, thanks, Julia, for this information, and thanks so much for United Services and what you do.
Thank you.
Strong community health also includes a healthy environment. Deborah Christensen from St. Charles County's Division of Environmental Health and Protection will show us a few of those benefits.
Going green is about saving our planet, saving our earth, saving our resources so that our planet remains healthy, living in a sustainable manner. We want to save those natural resources. We want to save and conserve non-renewable resources like coal, petroleum, aluminum, because once those things are used up, we will never be able to get those resources again. We also want to keep our resources clean, renewable resources for air, water. Another reason to go green is saves landfill space. Once those landfills are filled up, you and I as taxpayers are going to have to build another landfill. One of the things we really want to keep out of the landfills are electronics. They have a lot of harmful chemicals that can leak through one of the barriers in the landfill and can actually affect our groundwater. Well, the best way that you can go green is to reduce your waste in the first place. You can do that by just simple things, turning off your water when you're brushing your teeth. Some of the bigger things, you can save water in a rain barrel and use that for your garden. Use a cloth bag instead of plastic bags, composting your food waste. Just recycling 1 ton of paper saves 17 trees, 380 gallons of oil, 7,000 gallons of water, and saves enough energy to run a standard size house for 6 months. Just by recycling 1 aluminum can, you can save enough energy to run a TV for 3 hours. And 1 tree can actually filter 60 pounds of air pollutants each year. Another way of going green is to look for the energy efficient saving stickers that are on appliances. Another way of going green is to change out your light bulbs. You want to change those out to the compact fluorescent light bulbs. This will save you a lot of energy. Another way of saving energy around the home is that you turn off your computer when not in use. This can actually save you $70 a year just by shutting down your computer. Another small way that you can save energy around the home is to make sure when you're not using your phone chargers to unplug those, because that energy is constantly running through there. You can also go green by helping with the Mission Clean Stream event that happens every year. It's offered through Greenway Network. During Mission Clean Stream, a lot of the things that we pull out is general trash, a lot of metal that we use for artwork, and tires. A lot of tires come out of those lakes and streams. For more information on Mission Clean Stream, just go to the Greenway Network website. St. Charles does its part in going green by operating 2 recycling centers in the county, one in Wentzville, Recycle Works West, and Recycle Works Central in St. Peters. One of the fairly new things that we have, that we offer both of our recycling centers is styrofoam recycling. We're very excited about that. We take packing styrofoam only. As you can see behind me, I have these huge boxes of expanded styrofoam that will be sent off for recycling. We can compress 4 of these huge boxes of styrofoam into this small cube that is on my left. If you want to learn more about going green, please check out the Health Department's website.
Thanks, Deborah, and thank you for tuning in for another episode of Safe and Sound. Please join me next time to learn new ways to keep your family safe and sound.